which is a disease that we see in children that can be associated with COVID. This is very heavy on our hearts today as pediatric providers, as we have lost our first child to this disease in the state of South Carolina. It's always a sad day when we lose a pediatric patient to a disease. And I know that I speak for all the pediatricians and other pediatric caregivers that it's just a sad day for our little world in South Carolina. So the reason why I want to speak about it today is because I would like to educate the parents and other people out there about MISC and would like to give you some tidbits about it and what to look out for your kid. So MISC stands for multi-inflammatory syndrome in children. And like I said, it is associated with COVID-19. It is not an actual infection with COVID-19. It is actually an inflammatory response to the virus itself. It typically occurs approximately 2 to 3 weeks after a child has COVID-19, and it presents typically with symptoms such as fever, usually higher fevers around 101 or 102, can be higher, can be lower. And then you could also have things such as rash, red eyes, not feeling very well at all, decreased energy and appetite. You can have nausea or vomiting or diarrhea. And sometimes it just looks like flu-like symptoms, what we say, where you just don't feel very well at all. Children can be very irritable with it. And it actually ranges from any age, but typically it's in older children, school age type children. And it's a little bit different as this particular disease can actually affect older teenagers, which is a little bit different than what we see in other syndromes that are similar to this. So that includes 17, 18, 19, even 20-year-old children, which can kind of be out of that traditional pediatric grouping. And so I urge parents that if a child has symptoms such as these that I'm describing, that you reach out to your primary care physician and get your child checked out. I do want to caution parents, though, that if your child has not had COVID, it doesn't mean they can't have MISC. And what I mean by that is many children have asymptomatic infections with COVID. And so a child might not know, or you might not know, that your child was actually sick with COVID, and they were. And so unfortunately, MISC can also present in these children as well, even though you might not know that they actually had COVID. So at that, I will take questions.
Dr. Burch, I was just going to ask you, I know I know there was information about how many cases of MISC we've seen in South Carolina, and is there, and when did we start seeing them in relation to COVID?
Sure. So we have been seeing cases of MISC since the summer. And essentially, we have had approximately 40 plus cases in the state of South Carolina. Approximately 21 of those cases have been here in the Midlands. And so we kind of had a lull actually between the summer and now. But now that we're seeing more cases in the community, especially since the Thanksgiving and Christmas and New Year's holidays, we're actually seeing an uptick of cases with MISC as well.
The question is, are children with underlying conditions more susceptible to MISC?
So that is a great question. We are still looking at data that is being accumulated for this disease as it is brand new to the pediatric world. But what we are seeing is actually, at least in the cases that I have seen, most of the kids with MIS-C are completely healthy, normal kids. It seems to me that children who have underlying conditions are more likely to get acute COVID side effects versus the MIS-C itself.
The question is, what is the recovery period of treatment for MIS-C?
So all children who have MIS-C should be admitted to the hospital. The treatment is very similar to a treatment that we use for Kawasaki's disease. And that consists of something called IVIG, which stands for intravenous immunoglobulins. And so you get that through an actual IV. And then in addition to that, you also typically get steroids and aspirin. Some children are a little sicker than others, and so sometimes that means that they have to be in the intensive care unit, and they might get other supportive therapies in addition to the ones I just described.
Dr. Burch, a lot of the symptoms that we see in MIS-C are very similar to things that that parents see with other things. Would there be anything in particular that you think parents would pay more attention to than others?
Yeah, so it's really hard because what I described to you, just like I said, is very similar to flu-like symptoms. And so it can make it very difficult on parents on when do you want to call the pediatrician, because obviously you don't want to be calling your pediatrician all the time for every little sniffle that your child has. Specifically, when parents should call is if children have fever for days on end and it has not been going away. So that's 2, 3, 4 days worth of fever. And then also MIS-C typically makes children look much more ill than other classic viral illnesses such as the common cold and those kind of things. If you see that your child has fever and red eyes, that is a hallmark sign of MIS-C, and you absolutely need to call your pediatrician at that point. And then if again, your child is sick more than 2 or 3 days with the same illness, I think that should also prompt a parent to call your pediatrician and see if they need to be seen.
There's a question about the specific child, and Dr. Burch is not involved in the care of that child, so she can't speak about that child specifically. Dr. Burch, I was going to say, what about our parents out there? Should they be more concerned about COVID because of this MIS-C, what has happened, or what would be your advice to them?
So I think that this illness that led to the death of this child is very devastating. I do think that parents need to know and educate themselves about the symptoms of MIS-C, so you might be able to identify those in your child quickly. However, I do want you to know that there are the majority of the children who get MIS-C, or excuse me, the majority of the children who get COVID-19 do not have MIS-C. So we need to keep that in context. It is absolutely something that you want to look for in your child. And if you see the symptoms that are similar to to MIS-C, you want to get them to the pediatrician right away. But again, it is something that is not seen by any stretch of the means in all children who have COVID.
Is it usually diagnosed in the hospital or prior to being in the hospital?
That's a great question. It could be either one, to be honest. So in our institution in the Midlands, we have had children come through the emergency room. We've also had children come for their primary care physician or other urgent care facilities. So it can be any of those places. That's why I urge you, though, to reach out to your primary care physician because they are trained in the signs and symptoms of MIS-C.
Is it contagious? Are there concerns about MISC being in the school environment?
So, MISC itself is not contagious by any means. Again, it is an inflammatory reaction to the actual COVID-19 virus. So you don't have to worry about spreading MISC from one person to the other. It is more just, again, associated with the actual COVID-19, which we do know is spread from person to person.
It says South Carolina ranks second in the nation per 1,000 people for COVID. Statistically, where do we rank when it comes to COVID cases for children? Do you know?
I do not know that information off the top of my head, and I would not want to speak upon that because I don't know the correct answer.
Okay. Is MISC more of a concern with the new variants of COVID-19?
Great question. We don't know yet, to be honest. Again, this is all new to us. As y'all know, we have just gotten the first variant in South Carolina and also in the United States, but we have no idea how that is going to affect MISC cases. We'll obviously need more data for that. It would be my thought, however, that it would be probably the exact same as the current circulating serotype of the virus.
Dr. Burch, there's so much information out there and that's coming related to COVID-19. There's so many changes. And if parents hear this, they may be concerned. What would you say to a parent just to give them information about what they should be doing related to COVID-19 in general and to MISC?
Yeah, so we always go back to our basics, right, for helping prevent the spread of COVID. And those are the simple things we've been doing for a whole year now, which is making sure that you're wearing your mask when you're out in public, making sure that you and your children are washing their hands, that you are staying home if you're ill, and that if you think you have COVID, you actually go get tested and you pay attention to and obey the isolation and quarantine rules that are out there if you have been exposed or if you're sick yourself. That is the best way right now that you can protect yourself. Now, we do have the vaccine that is rolling out, and as more and more people get vaccinated, we should start to see a herd immunity. And hopefully we'll see a decrease of MISC cases as that helps to protect all of us from COVID-19.
I think that's the next question. In light of the surge in COVID-19 cases, how concerned are we that we'll see a surge in MISC cases?
Yeah, so we're definitely seeing that trend right now. So as we see the increase in COVID cases, we see an increase in MISC cases, and it just has to do with the number of cases that we're seeing. Typically, though, we are followed behind a surge of increase of COVID cases by 2 to 3 weeks, and sometimes even 4 weeks with a diagnosis of MISC. So it does not shock me that we are currently seeing more cases of MISC at this time. It reflects the number of COVID cases we're seeing.
Dr. Burch, can you describe what is actually happening in the body when a child has MISC?
Yeah, it's kind of a little bit more difficult, and the pathophysiology hasn't 100% been established, but essentially the easiest way to think about it, it's where your body has an overproduction of inflammation in response to the virus and the immune system's response to the virus. That's why we are treating it with IVIG and steroids and aspirin because those drugs help to decrease the amount of inflammation that you can have in your body.
That is all the questions we have for the day. Dr. Burch, I didn't know if you want to give some parting thoughts to reassure parents or remind them about their precautions. We'll let you have the final words.
Okay, yeah. So again, I urge parents just to educate yourself on MISC. You could always go to the CDC or DHEC website or the Children's Hospital websites. If you feel like your child could have symptoms of MISC, please contact your primary care physician. They can absolutely help you with that. And then also, when it is your turn to get your vaccine, I urge you to help protect you and your children and everyone around you by getting the vaccine. Make sure that we're good stewards on wearing our masks out in public and making sure that we're washing our hands and following all those mitigation rules that have been in effect for the last year. That's the best way that we can all protect each other. The Children's Hospital is here for you. If you need anything, let us know. Our ER is open. So it's a great place to come if you feel like your child needs help.
One last question, Dr. Burch. I thought that was such a good wrap, but anyway, there's just one other question, and that was, do we know of any long-term impact on a child's health after they've had a MISC diagnosis?
Yeah, that is a great question. We are all wondering that same thing. And actually, the CDC is mandating that all cases of MISC are reportable, so we can learn that information as time goes on. I do know that the CDC is instituting some research studies, and I'm crossing my fingers that the state of South Carolina will be part of that, so we can find out all those amazing questions that everybody has asked about the long-term effects of MISC.